Medicare helps cover major medical costs, but it does not cover everything. Premiums, deductibles, coinsurance, dental care, vision care, hearing services, prescription drug costs, Medigap premiums, and long term care expenses can still create serious financial pressure. And for retirees living on Social Security, pensions, or limited savings, these rising healthcare costs can directly affect monthly budgets, retirement security, and future planning. Hello, and welcome back. Today we are covering an important retirement and Medicare story affecting millions of older Americans. A new report highlights that many retirees expected Medicare to cover more of their healthcare costs than it actually does. At the same time, official Medicare data shows that the standard Medicare Part B premium for 2026 is $202.90 per month, with a Part B annual deductible of $283. This means healthcare remains one of the biggest expenses in retirement, even for people who are already enrolled in Medicare. For many seniors, Medicare is one of the most important parts of retirement planning. It helps pay for hospital care, doctor visits, outpatient services, preventive services, and other medically necessary care. But the key issue is this: Medicare is not free, and it is not full coverage. Many retirees still pay monthly premiums. They may also pay deductibles, co-payments, co-insurance, prescription costs, supplemental insurance premiums, and costs for services that Medicare does not fully cover. According to reporting from Barron's, many retirees say they expected Medicare to handle a larger share of their healthcare expenses. The report also noted that retirees can spend a meaningful share of their monthly income on healthcare costs, which can put pressure on household budgets. The main issue is simple. Many retirees are discovering that Medicare provides important protection, but it doesn't remove healthcare costs from retirement. For 2026, the standard Medicare Part B premium is $202.90 per month, up from $185 in 2025. The Part B deductible is $283 in 2026, up from $257 in 2025, according to the Centers for Medicare and Medicaid Services. That increase matters because many retirees pay the Part B premium directly from their Social Security benefits. So when Medicare premiums rise, retirees may feel that their Social Security increase does not go as far as expected. A separate MarketWatch report also highlighted retiree concerns over healthcare costs, especially because rising Medicare premiums can reduce the real value of Social Security cost of living adjustments. This is why many seniors feel squeezed. Their benefit may increase, but their healthcare expenses can also rise at the same time. Medicare is mainly designed for people aged 65 and older, as well as some younger people with disabilities. But Medicare is divided into different parts. Medicare Part A generally helps with hospital care. Medicare Part B helps with doctor visits and outpatient medical services. Medicare Part D helps with prescription drug coverage. Medicare Advantage, also called Part C, is offered by private insurance companies approved by Medicare and may include extra benefits. But retirees often need to make several decisions. Should they stay with original Medicare and buy a Medigap policy? Should they choose Medicare Advantage? Should they add a Part D prescription drug plan? Will their doctor accept their plan? Will their medications be covered? What will happen if they need dental care, hearing aids, or long term care? These questions matter because the wrong plan choice can create higher out of pocket costs later. Original Medicare does not cover many routine dental services such as cleanings, fillings, dentures, or implants in most cases. Medicare also states that most long term care, including non medical custodial care, is not covered. That is one of the biggest misunderstandings in retirement planning. Many people assume Medicare will cover nursing home care or long term personal care, but Medicare generally does not pay for custodial care if that is the only care a person needs. This matters because healthcare costs can change the entire retirement picture. A retiree may plan carefully for housing, groceries, transportation, and utilities, but unexpected medical costs can still create financial stress. For example, a retiree may have to pay for Medicare Part B premiums, prescription drug coverage, Medigap or Medicare Advantage premiums, deductibles and copayments, dental treatment, eyeglasses or vision care, hearing services, specialist visits, out of network costs, long term care, or home care support. These expenses can become especially difficult for retirees who depend mainly on Social Security. For many seniors, Social Security is not just extra income, it is the main monthly income source used to pay for rent, food, utilities, insurance, medicine, transportation, and family support. So when healthcare costs rise, the pressure is immediate. The human impact of this story is very real. A retired couple may believe they are financially prepared, but then one person needs regular specialist visits, prescription medication, dental work, or hearing support. Another retiree may discover that their Medicare Advantage plan has network restrictions, meaning they cannot easily see every doctor they prefer. Someone else may stay with original Medicare, but then realize they need a Medigap policy to help manage out of pocket costs. And for families dealing with long term care, the challenge can be even greater. Medicare says most long term care services are not covered, including many services that help with daily living, such as bathing, dressing, eating, and personal care. This can affect not only retirees, but also adult children, caregivers, spouses, and family members who may have to help financially or physically. From a retirement planning perspective, this story shows that Medicare planning cannot be treated as a small detail. It should be part of every retirement budget. Many workers think about when to claim Social Security. They think about 401ks, IRAs, pensions, and savings. But healthcare planning is just as important because medical costs can rise faster than expected and can continue for the rest of retirement. The key issue is not whether Medicare is valuable. Medicare is extremely important for older Americans. The issue is that Medicare does not eliminate all healthcare costs. Retirees need to understand what is covered, what is not covered, what premiums they must pay, what supplemental coverage may be needed, and how their plan may affect their choice of doctors, hospitals, pharmacies, and medications. This is especially important during Medicare open enrollment, when beneficiaries can review their plan options and compare coverage. A plan that worked well last year may not be the best choice this year. Premiums can change, drug coverage can change, provider networks can change, out of pocket costs can change. That is why seniors should review their Medicare options carefully instead of automatically keeping the same plan every year. There are still some developing issues. Healthcare costs may continue rising. Medicare premiums can change each year. Prescription drug coverage rules can also change. Medicare Advantage plans may adjust networks, benefits, prior authorization rules, and out of pocket limits. This means retirees should not assume that today's costs will remain the same in future years. The safest approach is to build healthcare inflation into retirement planning and review Medicare coverage every year. The main message is clear. Medicare remains one of the most important support systems for American retirees, but it does not cover everything. In 2026, many retirees are facing higher premiums, ongoing out of pocket expenses, and coverage gaps that can affect their financial security. For seniors and near retirees, the lesson is simple. Do not wait until a medical bill arrives to understand your Medicare coverage. Review your plan, check your premiums, understand your deductibles, look at your prescription coverage, confirm your doctors and hospitals, and prepare for costs that Medicare may not pay. Healthcare planning is retirement planning. What do you think is the biggest healthcare challenge for retirees today? Medicare premiums, prescription costs, dental and vision care, or long-term care expenses? Share your thoughts in the comments. If you found this update useful, please like the video, subscribe to the channel, and share your thoughts in the comments. We will continue bringing you clear and professional updates on Social Security, Medicare, retirement planning, senior benefits, and policy changes that may affect your financial future.